Well, a survey puts Indiana at the bottom of the list when it comes to best places to have a baby. News 8's Danielle Zulkowski explains how Indiana got this ranking and why one expert is not surprised.
Indiana comes in at the 40th best state to have a baby. This Wallet Hub survey takes cost, health care, baby friendliness, and family friendliness into account. And with Indiana only landing in the top 20 for cost, other lower scores brought Indiana's total ranking to the bottom 25%.
The survey took data from the 50 states and Washington, D.C. Indiana has 41.9 total points out of 100. Massachusetts is in first at 69.31 points, while Mississippi is last at 26.87. Indiana's worst rank was healthcare. Coming in at 44th out of 51, the 17 metrics that determined that score included access to care for mother and baby, mortality rates, vaccination rates, access to food, rate of preterm birth, and low birth weights, among other factors. Jessica Marchbank is with All Options. She says this data is not surprising.
It doesn't surprise me at all. I will say, I think that Indiana has some really good public health programs that are intended to support people with a new baby. I think they're most likely not reaching the people who most need those resources, the people most living on the edge of poverty or in actual poverty.
In terms of cost, Indiana ranks 18th out of 51. The state's highest score took into account costs such as delivery, child care, health insurance premiums, and newborn screenings. Marchbank works with low-income families. She says despite costs being lower, support is lacking.
I can say with confidence that people generally do not feel supported in a birth experience. There's just not a lot of medical or financial support for having a baby.
Marchbank frequently works with the Hoosier Diaper Fund. She says a lack of access to diapers can create a ripple effect in a family's economic stability.
It can cost up to $100 per month per child in diapers. Without enough diapers, they can't actually send the baby to childcare or daycare because you usually have to supply your own. If they can't send the baby to daycare, then that means mom or dad can't go to work. They also end up having some pretty dire health consequences, not just diaper rash, but actual infections.
Indiana is in the middle of the pack when it comes to baby and family friendliness. The Hoosier State ranks 33rd out of 51 for baby friendliness and 34th out of 50 for family friendliness because there was no data for Washington, D.C. in this survey. Baby friendliness included metrics such as parental leave, parenting groups, child care, and birth rate. Family friendliness included family fun, health and safety, education and child care, affordability, and socioeconomics.
The general fertility rate in the United States dropped less than 1% in 2022 from 2021, according to the CDC. That's after a 1% increase in the fertility rate in 2021 from 2020. I'm Danielle Zulkowski for Wish TV, wishtv.com, and like us on Facebook.